Welcome to Unique Mentors Online Physiotherapy Classroom, your platform to ace global licensure exams. Join us to know expert strategies and tips to crack the exams and unlock your physiotherapy career potentials. Let's move on to question number 1. Now, let me read out the question for you. Which of the following mobilizations is most appropriate for a patient with limited shoulder external rotation while in 90-degree abduction? Now the options goes like this: anterior glide, distraction glide, inferior glide, and posterior glide. Now I'll be quiet for a while for you to answer this. Just find out an answer in your mind. Okay. Now let's go with the right answers. Let's go with the rationale for this. Now the key information here is limited shoulder external rotation while in 90-degree abduction. Now the point here, the key point here is in 90-degree abduction, the most primary limitation is done by inferior glenohumeral ligament. Okay, it is the inferior glenohumeral ligament which is giving the primary restriction for shoulder external rotation at 90-degree abduction. Okay, now this is the key point here. This will be discussed in our orthopedic sessions in our theory classes. Now, the options here, the first option is anterior glide. Now, anterior glide, of course, that will improve the shoulder external rotation. But the problem is it will improve the shoulder external rotation only in the open pack positions. Okay. Now, distraction glide is another option which improves the external rotation definitely. But that also will improve the external rotation only in open pack position of the shoulder joint. Now, coming to the posterior glide usually improves the flexion only. So that can be ruled out completely. So now you have the leftover option, that is inferior glide, which becomes your right answer. Now see, as I told you, the key point here is 90-degree abduction. So in 90-degree abduction, the shoulder primary restraint is inferior glenohumeral ligament. So to stretch this inferior glenohumeral ligament, you have to go for an inferior glide. The anterior glide is avoided here because of the fear of subluxation. So in a 90-degree abduction, we will never go for an anterior glide, though it improves the external rotation. We will not go for the anterior glide because we have the fear of subluxation. So the right answer goes as inferior glide. Now let's move on to question number 2. Let me read out the question. When compared to upper extremity exercise test results, lower extremity exercise typically results in. The options goes like this: greater heart rate response, lesser blood pressure response, increased maximal oxygen uptake, that is option 1. Lesser heart rate response, lesser blood pressure response, increased maximal oxygen uptake. Greater heart rate response, greater blood pressure response, decreased maximal oxygen uptake, that is option number 3. Now, lesser heart rate response, greater blood pressure response, decreased maximal oxygen uptake. That is option number 4. So when you have such bigger options, the first thing that you have to do is elimination. So we have to see for 2 options which we can eliminate in the beginning itself. So the key point for this question here is, whenever we are finding for the exercise test results, you can see a peculiarity. The upper extremity responses are always, hemodynamic responses are always greater than lower extremity hemodynamic responses. So when you think of a BP heart rate response, whenever you are doing an upper extremity workout, it will be always greater when compared to the lower extremity. So the key information that you have to see here is, we need a comparison here with the upper extremity and lower extremity. Okay, And the point here is upper extremity exercise test results will be always, the responses will be, hemodynamic responses will be always greater than lower extremity hemodynamic responses. Now, so here you can see 4 options. The first part of this option, that is greater heart, regarding the heart rate responses, you have greater heart rate response for option number A and option number C. You have greater heart rate response. Okay. So immediately itself you can avoid or you can opt out, rule out the options A and C. Okay. Now you have 2 options to compare, that is option number B and option D. Okay, where you have lesser heart rate response. Now, there is another part for this option, that is another key information that you have to know is regarding the maximal oxygen uptake. So the maximum oxygen uptake will be always equally increased whether you are doing an upper extremity work or lower extremity work. Okay. For regarding the oxygen uptake, it will be equally increased in both upper extremity and lower extremity workouts. So now you can see in option B, it is lesser heart response, lesser blood pressure response, and increased maximal oxygen uptake. Okay. And in option D, it is lesser heart rate response, greater blood pressure response, and decreased maximal oxygen uptake. So your option B becomes your right answer because there is lesser heart rate response, lesser blood pressure response, and increased maximal oxygen uptake, which is correct for lower extremity workouts. So the key points, the key informations, and much more details on hemodynamic responses will be dealt in the cardiology sessions at Unique Mentors. Now we move on to question number 3. Let me read out the question. A patient who has suffered a traumatic blow to the posterior knee begins to exhibit signs of tibial nerve dysfunction. Which of the following impairments will most likely be present with a tibial nerve injury at the level of popliteal fossa? Now the option goes like this: weak angle dorsiflexion, loss of sensation to the dorsal surface of the foot. That is option A. Option B is weak angle plantar flexion with loss of sensation to the dorsal surface of the foot. Option C is weak angle dorsiflexion with loss of sensation to the plantar surface of the heel. And D, weak angle plantar flexion with loss of sensation to the plantar surface of the heel. Now, the key point or the key information here is, where does the sciatic nerve divide? The sciatic nerve divides into common peroneal nerve and tibial nerve at the popliteal fossa, just behind the knee joint. So, if the injury is above the popliteal fossa, the things will be different, and once it is below the popliteal fossa or at the popliteal fossa, the things will be different. This will be the key information in this particular question. So this is a tibial nerve injury, as you can see here, and the important point here is at the level of popliteal fossa. Okay. Now, once it is tibial nerve, as you know, the tibial nerve supplies the plantar flexors. So definitely the options having plantar flexion, weak plantar flexion can be included, and the options with weak dorsiflexion can be avoided. So let us avoid option A and option C here because it includes angle dorsiflexion. It is saying weak angle dorsiflexion. So these 2 options can be avoided. Now we have 2 options, possible answers now, that is option B and C, where weak angle plantar flexion is there. Okay. So the first part of this option is, or the first part of cracking this question is, which movement is affected? Okay, which movement is weak? Now in this, plantar flexion is weak, and that is right in both the options. In option B and option D, we can see It's weak ankle plantar flexion. Now, the second part of this question, we are checking for where is the loss of sensation. Okay. Now, if the tibial nerve is injured above the knee joint, above the popliteal fossa, there is a possibility that the dorsal surface of the foot is affected. The sensations in the dorsal surface of the foot is affected. Okay. Now, because the tibial nerve is here, it is injured at the level of the popliteal fossa. It's exclusively tibial nerve that is injured. So, the sensation, loss of sensation will be in the plantar surface of the heel. Okay. So, in option D, we can see weak angle plantar flexion. The first part is right. And the second part, loss of sensation to the plantar surface of the heel is also right. So, the correct option comes as option D. Now, this is how we crack those questions. The last question comes under orthopedic sessions. Please join us on our live online sessions to know more theory concepts. Follow us on social media also. Thank you so much.